Hi, I'm Lynn Matayana, and we're here at eHealth Media, and we're going to be talking today about treatments for chronic pain. Many of you know about medications and even things like exercise and nutrition, but today we're going to talk about something different that maybe you aren't familiar with. I'm here with Dr. Dave Williams from the University of Michigan, and he is an expert in cognitive behavior therapy. So, Doctor, we know that cognitive behavior therapy works, but what is it?
So cognitive behavioral therapy is a form of talk therapy that focuses on changing the way someone thinks about pain or thinks about their condition, their illness, as well as changing behaviors. And it's based on what we know psychologists have studied for years in terms of what works in terms of behavioral change. The types of behaviors we're trying to change are often very difficult to change. And so cognitive behavioral therapy done by a therapist many times can help the individual make very difficult behavioral changes over time.
So what kind of changes would a person want to make that has chronic pain?
Well, for example, if you have acute pain, it makes a lot of sense to maybe rest for a little bit or to stay, not socialize as much. Maybe you don't go to work that day as you allow your body to recover. Those types of behavior changes make a lot of sense for acute pain. Those are exactly the wrong things to do if you have chronic pain. However, you might not feel comfortable engaging in socialization, going back to work, or being active when you have chronic pain because of being fearful that maybe it's going to make your pain worse, or you don't think you can do it, or whatever. So you probably want to work with a therapist that you trust to make these behavior changes very gradually over time. And so behavior changes like engaging in paced activity, for example, very gradually increasing your functional status. Doing things like relaxation, engaging in pleasant activities to improve mood, dealing with structured problem solving, because everybody has a lot of problems when you experience chronic pain. And sometimes it helps to break them down and to do them in a structured fashion. Better communication skills with your physician or your family or your employer, for example. All these things can help kind of diminish some of the troublesome aspects of pain. For example, some of the emotional components and some of the cognitive components of pain. We're used to having medications that will target the sensory component, but we need to also have interventions that will target the emotional side and the cognitive side. And that's really what cognitive behavioral therapy does.
So if, for example, I just am a person that is very negative and I need to have a better positive attitude that I can get better, could cognitive behavior therapy help me?
Well, that would be the idea, but you'd certainly want to enter into that relationship, understanding and feeling comfortable with the therapist that's going to be working with you. It's not going to work if I just tell you, you just got to think positive and just think happy thoughts and you'll feel better and your pain will go away. That's naive and it won't work. You do want to identify the types of thoughts that you're having. For example, you might have thoughts about being helpless or not doing what you need to be able to do and feeling bad about yourself or whatever. So you want to be able to evaluate how rational those thoughts really are. And your therapist can help you do that. And then you replace those with alternative thoughts that are not necessarily positive, but more realistic as to what the situation really is.
Sometimes people talk about, they worry about the past or feel a lot of emotion about the past, or they're worried about the future. Is it important to stay in the present?
Well, we know that past events can influence pain. Certainly memories of similar pains from the past or how events have unfolded that have led to pain in the past certainly influences how much pain you're experiencing in the present. Many times in therapy, as opposed to some forms of psychotherapy that do go back and look at the past, I think cognitive behavioral therapy is a more present-oriented and future-oriented intervention.
I know that when I was told by my doctor I would get better, he couldn't promise me, that I would get well completely or that things would be perfect. But when he told me that things could get better, that gave me so much hope, and it made me feel like there was a chance that things could change and that I could get my life back. How important is it that people that you surround yourself with are positive?
Well, I think it can help. Being positive, but also realistic. And I think the
Right.
combination is real important. When in cognitive behavioral therapy, you do start off with a therapist that kind of helps you get going very gradually in terms of some of these behaviors and thinking processes that can be different. But the end goal of cognitive behavioral therapy is not to have the therapist with you forever, but that you're able to kind of take over your own self-management so that you're taking care of the emotional part and the behavioral parts of things. So cognitive behavioral therapy with a therapist oftentimes will then transition to self-management, where the person's able to do that, and hopefully they're surrounding themselves with positive people or people that are very supportive and understand their condition. I think what helps more than just having somebody be positive in your environment is to have somebody who knows you well and respects you and can understand why you may need one thing versus another.
And does journaling or reinforcement of ideas and things that you learn, can that be helpful?
Journaling is sometimes a part of cognitive behavioral therapy. There's also other forms of therapy that are really focused on journaling and emotional expression, getting your emotions out of your head and onto paper, because that makes it a little bit more objective and you can read them and think about them a little bit better. There's some of these interventions that are in clinical trial right now that involve journaling and are having some fairly good results for some folks.
Well, I thank you so much for being here today. I know that I learned a lot, and I know that our audience did too. So I appreciate Dr. Dave Williams being here, and we will see you next time.